In this video, we'll discuss important compliance and regulatory questions related to CPC exam. This will be part 2. To study compliance and regulatory notes and learn some more questions and answers, click the link above to check the playlist CPC Compliance and Regulatory. I will also mention link in the description. Let's start. AAPC credentialed coders have proven mastery of what information? Option A, code sets. Option B, evaluation and management principles. Option C, documentation guidelines. Option D, all of the above. So the right answer here is option D, all of the above. Next question. Local coverage determinations are administered by option A, NCD. Option B, state law. Option C, each regional MAC. Option D, NCCI. So the right answer here is option C, each regional MAC. Let us move on to the next question. When presenting a cost estimate on an APN for a potentially non-covered service, the cost estimate should be within what range of the actual cost? Option A, $25 or 10%. Option B, $100 or 10%. Option C, $100 or 25%. Option D, an exact amount. The right answer is option C, $100 or 25%. Let us move on to the next question. An APN must be signed when? Option A, once the insurance company has denied payment. Option B, before the service or procedure is provided to the patient. Option C, after services are rendered but before filing claim. Option D, once the denied claim has been appealed at the highest level. So the right answer is option B, before the service or procedure is provided to the patient. Next question. A covered entity must obtain consent of the individual to use or disclose PHI, that is protected health information, to carry out all but what of the following? Option A, for public use. Option B, payment. Option C, treatment. Option D, healthcare operations. So the right answer is option A, for public use. Next question. What is a NPI? Option A, National Payer Incentive. Option B, National Provider Index. Option C, National Payer Identification. Option D, National Provider Identifier. The right answer is option D, National Provider Identifier. Next question. HITECH provides a -D window during which any violation not due to willful neglect may be corrected without penalty. Option A, 40. Option B, 90. Option C, 30. Option D, 120. The right answer is option C, 30. Next question. Which act was enacted as a part of American Recovery and Reinvestment Act of 2009 and affected privacy and security? Option A, HIPAA. Option B, HITECH. Option C, SSA. Option D, PPACA. The right answer here is option B, HITECH. Let us move on to the next question. The AAPC offers over 500 local chapters across the country for the purpose of option A, membership dues. Option B, continuing education and networking. Option C, regulations and bylaws. Option D, financial payment. So the right answer here is option B, continuing education and networking. Let us move on to the next question. In what year did HIPAA become a law? Option A, 1995. Option B, 1996. Option C, 1997. Option D, 1993. The right answer is option B, 1996. Next question. The 2012 OIG work plan prioritizes which of the following topics for review? Option A, fracture repair. Option B, dystrophic nail care. Option C, lesion removal. Option D, E&M services during global surgery periods. The right answer is option D, E&M services during global surgery periods. Next question. Medicare Part D is what type of insurance? Option A, prescription drug coverage available to all Medicare beneficiaries. Option B, physicians coverage requiring monthly premiums. Option C, hospital coverage available to all Medicare beneficiaries. Option D, a Medicare Advantage program managed by private insurers. The right answer is option A, prescription drug coverage available to all Medicare beneficiaries. Next question. Which of the following health plan does not fall under HIPAA? Option A, Medicare. Option B, Medicaid. Option C, workers' compensation. Option D, private plans. The right answer is option C, workers' compensation. Next question. The Medicare program is made up of several parts. Which part covers provider fees without the use of a private insurer? Option A, Part B. Option B, Part A. Option C, Part C. Option D, Part D. The right answer is option A, Part B. Next question. Who is responsible for enforcing HIPAA security rule? The right answer is option D, OCR. OCR full form is Office for Civil Rights. Next question. Which program was developed by the CMS to promote national correct coding methods and to control inappropriate payment of Part B claims and hospital outpatient claims? Option A, NFS. Option B, HIPAA. Option C, NCCI. Option D, MAC. The right answer is option C, NCCI. NCCI full form is National Correct Coding Initiative. What form is used to submit a provider's charge to the insurance carrier? Option A, UB04. Option B, CMS 1500. Option C, Provider Reimbursement Form. Option D, APN. So the right answer is option B, CMS 1500. Next question. I am sharing important information regarding the CPC exam. So please don't forget to like, share and subscribe to my channel. Which of the following choices is not a benefit of an active compliance plan? Option A, eliminates risk of an audit. Option B, fewer billing mistakes. Option C, increases accuracy of provider documentation. Option D, more accurate payment of claims. The right answer is option A, eliminates risk of audit. Next question. What document is referenced to when looking for potential problem areas identified by the government indicating scrutiny of the services within the coming year? Option A, OIG Compliance Plan Guidance. Option B, OIG Security Summary. Option C, OIG Work Plan. Option D, OIG Investigation Plan. The right answer is option C, OIG Work Plan. Next question. Which provider is not a mid-level provider? Option A, anesthesiologist. Option B, all choices are mid-level providers. Option C, physician assistant. Option D, nurse practitioner. The right answer is option A, anesthesiologist. Next question. What document assists provider offices with development of compliance manuals? Option A, OIG Compliance Plan Guidance. Option B, OIG Work Plan. Option C, OIG Suggested Rules and Regulations. Option D, OIG Internal Compliance Plan. So the right answer is option A, OIG Compliance Plan Guidance. Next question. What is the difference between outpatient and inpatient coding? Option A, outpatient coders use ICD-10-CM and ICD-10-PCS. Option B, outpatient coders only focus on hospital services and inpatient coders focus on physician services. Option C, inpatient coders have more interaction than outpatient coders. Option D, inpatient coders use ICD-10-CM and ICD-10-PCS. The right answer is option D. That is, inpatient coders use ICD-10-CM and ICD-10-PCS. Next question. Under the privacy rule, the minimum necessary standard does not apply to what type of disclosures? Option A, uses or disclosures to drug companies. Option B, disclosures to or request by family members. Option C, disclosures to the individual who is the subject of the information. Option D, uses or disclosures to insurance companies. So the right answer is option C, disclosures to the individual who is the subject of the information. Next question. What form is provided to a patient to indicate a service may not be covered by Medicare and the patient may be responsible for the charges? Option A, LCD. Option B, CMS 1500. Option C, UB04. Option D, ABN. So the right answer is option D, ABN, Advance Beneficiary Notice. Next question. LCDs only have jurisdiction in their option A, locality. Option B, region. Option C, state. Option D, district. The right answer is option B, region. LCD full form is Local Coverage Determinations. Next question. Select the true statement regarding ABNs. Advance Beneficiary Notice. Option A, Advance Beneficiary Notice may not be recognized by non-Medicare payers. Option B, ABNs must be signed for emergency or urgent care. Option C, ABNs are not required to include an estimate cost for the service. Option D, ABN should be routinely signed by Medicare beneficiaries in case Medicare doesn't cover a service. The right answer is option A. ABNs may not be recognized by non-Medicare payers. All the other statements are not true regarding ABN. Next question. What are the different parts of Medicare? Option A, Part A, B, D. Option B, Part A, Part B, Part C, Part D. Option C, Part E, F, G, H. Option D, Part A and B. As we already discussed, the parts of Medicare are Part A, Part B, Part C and Part D. The right answer is option B. Let us move on to the next question. According to the AAPC Code of Ethics, which term is not listed as an ethical principle of professional conduct? Option A, integrity. Option B, efficiency. Option C, responsibility. Option D, commitment. So the right answer is option B, efficiency. Let us move on to the next question. Which is not one of the 7 key components of an internal compliance plan? Option A, develop open lines of communication. Option B, conduct training and not perform education on practice standards and procedures. Option C, enforce disciplinary standards through well-publicized guidelines. Option D, conduct internal monitoring and auditing through the performance of periodic audits. The right answer is option B, conduct training but not perform education on practice standards and procedures. So this is not one of the 7 key components of internal compliance plan. Next question. What is a mid-level provider? Option A, non-licensed PAs. Option B, physician withholder. Option C, mid-level providers include PA and NP. Option D, NPs with bachelor's degree. So the right answer is option C. Mid-level providers are PA and NP. PA means physician assistant and NP means nurse practitioners.